Hello, my name is Vinny Gangitano, and this is injury prevention on a hip flexor strain. So to start, I just want to go over what a hip flexor is. It includes of three muscles, the iliacus, psoas major, and psoas minor. Those collectively are known as the iliopsoas, and they originate from the lower vertebrae, such as the lumbar vertebrae and lower thoracic vertebrae, and they insert at the lower trochanter of the femur. Their main function is, of course, flexing the hip, like it says in the name, but it also assists in external rotation. A hip flexor strain is torn muscle fibers of the iliopsoas. It can be either of those three muscles that I mentioned. Some symptoms are pain with hip flexion and extension, tenderness, and loss of function. This loss of function comes from the actual tearing of the muscle fibers, causing the muscle to weaken, and it can limit activity because of that pain and the loss of strength and power you get from those muscles tearing. And it's caused mainly by sudden movements and overuse, such as running or cutting. Who is prone to hip flexor injury? Like I said, athletes who are running are prone because they're overusing that iliopsoas, causing irritation and friction to build up and tightness, and also weak muscles of the surrounding muscles of the iliopsoas cause more stress to be put on the iliopsoas, causing it to work harder, which causes it to tighten up and be more prone to tearing. And also, not warming up or stretching the hip flexor is bad because it isn't loose and it can tear more easier when it's tight. Preventing iliopsoas injury is relatively easy. You just want to warm up, cool down, and stretch properly. This includes this half kneeling stretch, which works great. And another thing is strengthening the hip flexor and the surrounding muscles, such as this glute bridge, helps a lot because strengthening the hip flexor allows those muscle fibers to be stronger, which can help them not be torn as easy. And the final thing, which is pretty easy but very important, is resting properly. This just means taking a day off every once in a while or icing or heating whenever you need, because the more you use that torn hip flexor, the worse it's going to get, and it's never going to heal if you keep using it. So my patient was Ronan Fisher. He is a tri-sport athlete of football, basketball, and track. This means he's always running pretty much every day, except he has a few rest days, like the weekends when we don't have practice. And he recently started lifting weights and stretching because he's had this injury in the past and he does not like it. And once he started lifting and stretching it, it has diminished and gone away pretty much completely. And the reason we did this program was because he does not want to deal with the injury again. I don't blame him because from personal experience, this injury is terrible. Our program includes six-ish things, more like 5.5. And number one is the half kneeling hip flexor stretch. That's this one. And as he pulls his arm up, his hip flexor stretches out and becomes looser. And the 90-90 stretch is shown here. The supine hip flexor stretch is shown here. He's pulling this knee up to his chest, and his hip flexor on this leg is getting pulled. And the side lying hip flexor stretch shown here. You really want to focus on pushing your hips out to engage that hip flexor. And then the butterfly stretch, basic one, just flexing the hip like overall. And finally, general lifting of weights or even body weight exercises are great. And he's been doing those since the school year started and last year over the summer. And ever since then, his injury has diminished, like I said before. And an example of body weight exercise is the single leg glute bridge, which he did a few of in my program. And pretty basic stretches, but like I said, these are very effective and important to limit the injury. And the results to test his hip flexor, I used the Faber's test and a goniometer. And as you can see here, The Faber's test, it was negative because his hip is almost flat. It's a little up, but I'm sure we all have that, so that's normal and pretty loose. And with the goniometer, it was kind of hard to get an actual reading, but it was around 5 degrees. And these were the same before and after. And so my program did not work, but that's probably because he's been doing a similar program and strengthening and stretching his hip ever since he's had this injury because he does not want to have this injury again. So that's my project, and thank you for watching.